So regenerative medicine is a branch of healthcare research and tissue engineering that basically deals with the process of repairing, engineering, or regenerating human cells, tissues, or organs in order to establish normal function. Meaning, if somebody has a bad knee and we want to make the knee better by giving them enough of this regenerative medicine to help their body fix itself. Now, I want to say this really, really quickly so that everybody understands. Most of us think that when we first get into this, that the stem cells that we're injecting and the regenerative properties that we're injecting, we think that they're going inside and they're turning into tissue. That's not true. Our body has a whole bunch of different stuff inside of it, and it lays dormant. I mean, and when I'm talking about stuff, I'm talking about osteophytes, all the different stuff to grow the stuff, as well as our own resident stem cells exist in our bodies. When we introduce this stuff into the people, what it's doing is waking it up out of its slumber, it's bringing it out of its coma, it's animating it to life, and it's causing and helping our bodies regenerate themselves. That's an important distinction. So these injections and these treatments that we're doing, we're injecting them into a patient. We're causing the resident regenerative properties inside to wake up and regenerate the own body. So that's what regenerative medicine is. Stem cells. Stem cells are what are called undifferentiated cells, meaning they're still neutral and they have not decided what to turn into, what they can, or what they will become. So many doctors around the country are using these stem cells to help people to repair any damaged or diseased tissue that a patient may have. So the type of stem cells that we're interested in and the type of stem cells that we're working with are called Syncable stem cells. Some people say them as mesenchymal. So Syncable stem cells are adult stem cells. So they are from the birthing process, from a live birth. They are not embryonic. They're not fetal cells. These are considered adult stem cells. The ones that we're working with and the ones that we're using are from the Wharton's jelly of the umbilical cord. Now, when we have this umbilical cord, there's two people attached to it, right? There's the baby and there's the mother. The umbilical cord closest to the baby it's actually really, really rich in these mesenchymal stem cells. Towards the mother, it's more rich in like growth factors. And the way that I look at it, the stem cells are kind of like the general contractor of a house, and the other things that we use, like the cytokines, the proteins, the growth factors, the fibrogen, the collagen, all the stuff is like it's like the other workers, as well as the material needed to repair or fix a house that may be damaged, right? So all of these things are necessary. So the cool thing is everything that we need is kind of right there in the umbilical cord. We harvest it from the Wharton's jelly. The Wharton's jelly is like a substance that wraps around the umbilical cord, and it cushions it and it protects it so that it doesn't get damaged. Now, mesenchymal stem cells or mesenchymal stem cells are what's called multipotent, meaning they can differentiate or they can change from that neutral cell that we talked about into another type of cell, like a cell to help build cartilage, or a cell to help build muscle, or a cell to help build tendon. So they can actually turn into different cells. Now, the other types of cells that we were talking about before, like an embryo cell, they're actually a different type of stem cell. They're not an adult stem cell, and they're not multipotent. Multipotent can only turn into several different types of cells. Other cells that are like from the fetus could be pluripotent. Pluripotent is not what we want. Pluripotent, they can turn into a whole bunch of different cells, including even tumor-type cells. So we do not want pluripotent. We want multipotent. The Syncable stem cells are multipotent. They can only turn into a various few types of. These are the cells that we want for these orthopedic applications. They're the cells that we want for the arthritis, or the cells that we want for the sexual health, that we want for the hair restoration, for the aesthetics and the cosmetics. The cool thing about the Syncable stem cells is they're actually non-tumorigenic, meaning they do not cause tumors. They are not known or ever been seen to actually cause tumors. The other thing they do is they help the body having a normal immune response. So they don't. What they do is, the cool thing is, most things, the first things that most doctors learn when they go to medical school is that anything that gets put into a body that's foreign, your immune system or your T, there's going to be this T cell response. They're like the warriors that look out to protect us. When they see that there's something that's not supposed to be there, they attack it and they kill it. So most of the time, and a lot of the other cells that they were using when they first got into regenerative medicine, that was one of the problems. So they'd have to lower the person's immune system to allow the cells in. That's not what we want. The Syncable stem cells are multipotent. They can only they can change into several different cell types, and they're the cell types that we're looking for the applications we're using it for. They also are what's called immunoprivileged, meaning the body will not reject them. They don't cause a rejection or an immune response from the body to try to get rid of them. They actually produce this molecule, and it's basically like when you in Star Wars, or like, you're not the drones you're looking for or whatever. Remember they did that? The Jedi did that. They do the same thing. They produce this molecule, and it allows your immune system to not notice them and cause this response. So that they actually go into somebody's body, and they're able to actually work in there and live in there for about 4 to 8 months. So imagine, when we see people in physical therapy, we see people for physical medicine or for chiropractic care, we usually PM&R, pain management and rehabilitation, usually 2 or 3 times per week, right, for X amount of weeks. Well, when we do an injection with this biologic, this living tissue that we're putting into somebody, it can actually be in there and work for between 4 and 8 months. So imagine every second of every minute of every hour of every day, when we do this injection into our patient, we're actually treating them. That biologic, that tissue that we put in there, is actually in there working to help the body. And remember, it's in there to help the body fix itself. They're not in there fixing, they're in there helping the body fix itself. And so that's the great thing about these Syncable. They're multipotent, they're non-tumorigenic, they're not known to cause tumors, and they're immunoprivileged, meaning the body will allow them to be in there and work for 4 to 8 months. What do mesenchymal stem cells or mesenchymal stem cells do? They help reduce inflammation. Inflammation is one of our greatest enemies of our bodies. It causes pain. So what do most people come to us for? Oh, my knee hurts. Oh, my shoulder hurts. There's probably inflammation. So inflammation causes pain. It's also been linked to a lot of autoimmune type diseases. It's also been linked to even causing cancer, Parkinson's, Alzheimer's. Inflammation is not our friend. We want to get inflammation of our body. So Syncable stem cells help reduce inflammation in our body. They also help modulate our immune system. So sometimes our immune system, and people don't realize how important our immune system is to healing. Not just to not get a flu or not get a cold, but to actually aid in healing. So the immune system is super important. Sometimes the response, our immune response, is too low, and it's run down, and parasites or viruses or bacteria actually kind of get ahead, and we can get sick, right? Sometimes our immune response is too much, meaning it's freaking out, and that's been known to cause a lot of autoimmune diseases. So one of the reasons that Syncable stem cells are so helpful also in autoimmune diseases is because it helps regulate the immune system. It helps give it the actual right response that we need. The next thing it helps with is actually the reduction of scarring. This is one of the reasons it's so good also in cosmetics. But they've actually shown that people scarring happens when we have an accident or an injury. And it's our body trying to fix itself, and sometimes it lays down this fibrotic tissue, and it can actually interfere with normal function or actually even repairing. So they help reduce inflammation, or it helps modulate or have the immune system, if it needs more help to get brought up, it brings it up. If it needs to be brought down, it brings it down, and it helps reduce scar tissue. Now, the other thing it helps to do is helps the body regenerate. Right? This is an important thing. When somebody has a knee that's degenerating, meaning it's injured, is bad, and is getting worse, they're going to help get the body better. And of course, the one thing that we love about these Syncable stem cells and this regenerative medicine stuff that we're doing is we found that it gets really, really good results. So we have a patient that got treated 3 weeks ago with Parkinson's. His Parkinson's was pretty advanced. If any of you were at the seminar that we had in Orlando in November. He was actually there. The patient was there. He had a walker. His name was Paul. 3 weeks ago, he got treated with Restore, which is our Syncable-based product, as well as some exosomes. That's for a whole other topic. And 3 weeks post, he also had severe knee pain. His knee pain is nearly gone. His tremors are now almost non-existent. And he used to have this weird thing that was going on where his body would actually freeze. So imagine you're walking along, you're not doing good, you have Parkinson's, and you're shuffling and whatever else, and all of a sudden your body just gets frozen, right? You can't move, and he'd lock up and he'd freeze. His body has stopped doing that. His tremors are mostly gone. He has more normal gait, and his knee pain is almost non-existent 3 weeks later. So we get great results. Why does it get great results? It helps the body rebuild, restimulate. It modulates the immune system. It reduces inflammation and helps get rid of the fibrotic tissue. So let's talk about, we now talked about what they are. They're these cells that are not really anything, and they can turn into any cell that we need. Pretty cool. They're able to become the type of stuff that we need to fix our body. Now, here's the deal. When we're born, we basically get an allowance or an inheritance of these stem cells, right? Of these Syncable stem cells. We have more of these per capita, meaning than we will ever have in our life the second that we're born. Now, the other thing that happens when we're born, this whole war basically starts between our bodies trying to die or degenerate and our bodies trying to regenerate and maintain themselves. Now, that's called homeostasis. That's one of the things that these stem cells do that's so important. They help us maintain life. They help us with homeostasis. They actually help us maintain life. They keep what's called the status quo. So when we're born, we have one of these stem cells for every 10,000 cells that exist in our body. That's the most we've ever, that's the highest concentration of them we're going to ever have. The second that we're born, believe it or not, our bodies try to die. Every 5 minutes, we have about 15 million blood cells that actually die, and they have to be replaced. They got to be replaced. They got to be replaced. Our bodies start to be exposed to the elements. They actually start to die. The thing about it is that we have one of these stem cells for every 10,000 cells. We have more in our regenerative bank account or in our inheritance than we're going to ever have. Now, how do we use them and how do we lose them? Well, when we're born, we're a little baby, and we have to grow to our skeletal maturity, right? We have to grow our bodies as tall as we're going to get. So, and that usually happens in our late teens or our early 20s. Now, by the time that we actually grow our bodies and we get to our skeletal maturity, or we are as tall as we're going to get, we actually have used up, this is a scary number, 90% of our inheritance. It takes a lot of effort and a lot of work to actually grow our bodies from being a little baby to a full-grown adult. And by the time that we hit our skeletal maturity, our early teens, late teens, early 20s, we've used up 90% of what we were given, all right? And we have to live the rest of our lives on the remaining 10%. So think about that. So these cells help us what? Our immune system, which is very important. They help modulate the immune system. These cells also help reduce inflammation, which is very, very important. They help reduce scarring every time we've had an accident or injury. And they also help us keep the status quo or maintain life and have our bodies to regenerate. See, there's this war in our bodies from the second we're born, regeneration and degeneration. So our bodies are trying to die, and we're trying to not let them die, so we replace the cells. It's like, oh, I just lost $1. Let me put another $1 there. And we actually spend money from our regenerative account. So by the time we were in our skeletal maturity, our early 20s, we've actually spent 90% of our inheritance. We got to try to live on our retirement of these, or basically however you want to say, on this remaining 10%. Now, there's other things that happen to these cells as well. As we age, so do they. I mean, have you noticed how that as people get older, they slow down? Unfortunately, I've noticed that myself, right? So as we get older, our bodies seem to slow down. Well, so do our stem cells. Now, what we talk about that is the proliferation rate or the change rate, or we call it the doubling time. The day that we're born, it takes about 20 to 24 hours for one stem cell to become another stem cell. Remember ninth grade biology, mitosis, the cell goes and it becomes another cell. So the doubling time that it takes for one cell to become another cell is 20 to 24 hours. Now, that doesn't seem like too big a deal, right? But here's the cool thing. One cell can turn into 1 billion, that's a billion with a B, 1 billion cells in 30 days. What happens is you got to remember the last few days is like, okay, we have 1 million cells. Now we have 2 million cells the next day. Now we have 4 million cells the next day. Now we have 8 million cells the next day. It grows, it starts out slow, but by the end of 30 days, that one cell becomes 1 billion cells. Now that's super important. Why is that important? We're trying to grow a body, right? We're trying to overcome degeneration. And we have accidents and injuries. How many times do little babies fall and hurt themselves as they're trying to learn to crawl or walk? How many times do little kids fall off their bicycles? See, we also use them and lose them not just by growing our body or maintaining our body, not letting it degenerate, but we also, every time we have a bump, a bruise, a scrape, every time that we get sick, every time that we eat food that causes inflammation, look at foods that cause inflammation. Probably most people, probably 3 or 4 times a day, they're actually causing the use of stem cells just by what they're putting into their mouth. So, because when we have things that get inflamed, stem cells have to get taken from our account and go there to reduce it. So by the time we're in our early 20s or late teens, we have 10% of them less. They're already starting to slow down a little bit. Now, the other thing that happens is when we're born, these cells, these Syncable stem cells, can help produce around 300 different types of proteins, growth factors, cytokines, all the stuff that we need to grow and maintain a body, right? So when we're born, we have more of them than we ever will have, right? Concentrated. They're faster than they'll ever be, meaning they can turn into another cell every 20 to 24 hours. And they can produce more regenerative properties. They can produce over 300 different types of proteins, cytokines, growth factors, etc. Now, of course, what kind of happens? We start to age. And if you look at a body, one of the things you want to think about, if you look at one person and you take somebody who lived to be from 0 to 90, if we look at the same exact body over a 90-year span, you'll find in the first 30 years, not only is there not very much aging, but actually what happens is we have to grow the body. There's actually generation. We're generating a body. So the first 30 years, we're generating the body. There's not much aging. Now, the next 30 years, 30 to 60, the aging process seems to really start to happen, right? It starts to really happen. And we see a lot more aging from 30 to 60 than we saw from 0 to 30. And then, of course, from 60 to 90, it almost drops off, right? The aging just accelerates and accelerates and accelerates. Now, I want you to think about it. We're on that body was on this planet for the whole 90 years. It's the same person, the same body. 3 different points, and people will go, well, that's because they got older. Well, let's talk about why people get older and how they age. Remember, when we're born, we have more Syncable stem cells as far as concentration that we'll ever have. They're faster than they ever will be as far as doubling or proliferating or becoming another cell, and they can produce over 300 different types of materials to help the body regrow or regenerate itself. So basically, we have so much regenerative properties that we can overcome degeneration in that first 30 years. Now, the next 30 years, they start to slow down, and we've used up 90%, right? So we don't have that many numbers anymore. But here's the other thing. By the time we reach about age 50, if you looked at how many different materials or growth properties or regenerative properties that the body can produce, it's already less than 100. So already we can produce over 300 different types of growth properties, regenerative properties. Now it's less than 100. It's 3 times lower. We also have used up 90%, or by now more than 90% of what we have, our allotment. And of course, these cells are getting older like we are, and they're starting to slow down. When we get to be age 65, most of the patients, I usually jump right to age 65 is because most of our patients are between 65 and 85, right? A lot of the people, 60 to 80. When we're 65 years old, it takes 60 hours for one of these stem cells to go from one cell to another cell, right? So it's 60 hours. What does that mean? Well, remember, when it was 20 hours, one cell could turn into 1 billion cells. When it's 60 hours, it only can turn into 200 cells. So remember, what are these cells? It is 1 billion with a B to only 200. So when you think about that, only 200, if you have a problem with your knee, now these cells are slower. We don't have as many. Our army is almost, there's this war of generation versus degeneration, right? So there's this war. We don't have as many of our warriors, our soldiers anymore. We've lost 90% just to grow our body. Our soldiers are now older, and they don't have as much materials to fight this war with, right? You have this knee problem. Well, why all of a sudden do we have a knee problem or a shoulder problem, and our body's been able to fix itself throughout its whole life, but now why can't it? Because one of the things that these things help us with is to actually maintain our life. We basically don't have enough funds in our account to pay for the damaged knee, right? We don't have enough of these resources to actually keep up with the degeneration versus degeneration. What happens? We grow these bodies. We're in the generation process of our life. Then the amount of regenerative properties that we have becomes less than it was actually necessary. Remember, if we could have unlimited generation properties that could regenerate or cause genesis to happen, to continue things, we would never age. What happens is we use up so many, they can't produce as much, and we don't have as many, and they're slower. And basically, our bodies, we can't keep it the same. Remember, one of the things these mesenchymal stem cells do is they keep the status quo. They're supposed to keep things normal, but we don't have enough of it left to keep it normal, and it allows our body to degenerate. That's aging. So what happens is people get older and older and older, where the body's just trying to keep up and maintain its life. It can't fix its knee. It can't fix its shoulder. It can't fix its hip. There's not enough there. Not only is there not enough there to fix it, they're slower and they don't produce as much. This is what happens. And basically, when people die of a natural death, they now don't have enough regenerative properties to generate life, and the degeneration process basically wins. So as we age, we use these. We use these to maintain our life. Every second of every day, we're using these cells up to actually maintain our life. Every time we have an injury, an accident, a slip or a fall in our entire life, or ate food that could cause inflammation, we've been dipping into our storage of these things. And what's happened is we basically don't have enough of these properties to overcome degeneration. Your body is aging, and your body can't fix your knee. So what do we do with regenerative medicine? We do a tissue transplant, right? We do a tissue transplant from the birthing process when there was one of these mesenchymal stem cells for every 10,000 cells, where they could proliferate or become another cell every 20 to 24 hours. And when they could produce over 300 different types of regenerative or generative type properties, like fibrogen, collagen, the stuff that we need to actually fix and maintain and grow the body. So we're going to take it from when it was as powerful enough in your body to actually overcome degeneration and grow your body, and we're going to transplant it right into your knee and help that body fix itself. So this is how we explain this to people, right? So as people start to understand this and you start to remind them and you start to show them during the consultation history, look at all the things that you've done over your life, the accidents, the falls, the food that you've eaten, the way that you've lived your life, your body just to get you to this point and using them up. They start to understand, well, wow, this is why my knee's not fixed. This is why I don't feel the same, or I don't have this, or they start to have the understanding of how their body has been breaking down and why there's several reasons why they're not better. One, they have not tried any type of treatment that's been designed yet to actually fix the problem that they have. They've all done that managed care stuff. The other thing that they start to realize is how do they know that this has a great chance of working? I know that the Syncable stem cells work, and I know there's 7 billion examples on planet Earth. It's called humans. If you don't have the Syncable stem cells in your body and your regenerative properties, you can't maintain life. So we also know that they will work for these people because, one, they were able to be born and grow into a full-grown adult, and it was the Syncable stem cells and all these regenerative properties that helped modulate their immune system their entire life. It helped actually every time they had inflammation, it lowered inflammation. Every time they had a slip, a fall, a bump, a bruise, a severe accident, or even a surgery, right? Every time they had one of those things that happened, it was the Syncable stem cells and all these other regenerative properties together not just the mesenchymal stem cells, but the fibrogen, the collagen, the cytokines, all of this stuff that helped not only fix the body, was the building materials to get it back together. So we know it would work. The problem is they don't have that many of these cells left, or these properties left. They're very, very slow, and they don't produce as much as they used to. But if we could take them from the time that they were first born, when they had the ability to do everything that we've talked about, and we can put them right where they need them, this is why we're seeing these incredible results. This is how we're seeing the bodies fix themselves. This is how we're seeing things get back to normal, and that's causing people's pain to go away. It's not hiding it. It's trying to get the body to put itself back to how it was designed to be, so that the pain goes away, it stays away. They can walk, they can move, they can exist in life without pain. They can do their hobbies, they can live their life.